Well, good afternoon, and thanks for joining us for today's Healthline 3. I'm your host, Courtney Butts, and Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering your questions live in the studio today, and we're opening those phone lines soon, but first, as a reminder, make sure your TV is turned all the way down and you're in a quiet room when you call so that we can hear your question. The number to call is 318-219-4569, and today's topic is joint health and advanced technology. Joining me today to talk about this is Dr. Chatrath, an orthopedic surgeon with Willis Knight & Bossier Orthopedics. Thanks for joining us.
Well, thank you for having me here, Courtney. I really appreciate it.
Absolutely, and you're a wealth of knowledge, so I'm excited to jump in and talk about our joints, how we can preserve them, but then also what to do when maybe you're in a lot of pain.
Absolutely.
Yeah. Okay. So earlier in our newscast, we did talk about just overall joint health. How important is it to maintain the integrity of your joints?
It's very important because your entire mobility depends on it, irrespective of your age, whether you're a younger individual, you're an older individual. Your joint health is paramount. If you're younger, we have to go to your jobs, take care of young families, kids, enjoy some sporting activities. When you're older, you still want to continue a lot of these, but the kind of responsibilities may change. You may not exactly decide at 70 that I'm going to play college football or something, but you still want to go play a round of golf. You want to go enjoy some tennis. So you still need a lot of emphasis on your joint health. The second part of this is if your mobility gets compromised, you tend to put on weight, which again will cause problems of blood pressure, diabetes, and all the excessive issues which go with obesity. And then that's another cycle or another can of worms that comes, and it all started because you had poor joint health.
Yeah. Okay. And so explain to me, what do the joints do in our body? Like what do they serve? Purpose do they serve?
Absolutely. So what I focus on is the larger joints, hip, knee, and shoulder joints in my practice. And think of joints the same way as your car parts. They basically have a lining inside them. The lining generates a fluid, which you can call the engine oil, okay, and keeps the parts moving, gliding motion, so you're able to move around without anything hurting. You're able to carry on your activities. Now, having good joints also leads conversely to having good muscle strength, because you're moving your joints and you're moving the muscles along with them. If your joint's hurting, you really can't move that muscle, so you end up losing muscle mass, you end up losing strength as well, and you become more prone to injuries.
Yeah. Strength training is really important for protecting your bones as well. Would you say that that's maybe something that can contribute to more injuries if you have a fall as well?
Absolutely. So strength training is extremely critical. After you hit the age of 40, most people start losing 5% of their muscle mass every 4 to 5 years, which is a big number. So strength training helps to preserve that. There is some data which came out from the National Institute of Health, and it said every person should at the minimum get 30 minutes of some weight-bearing exercise 5 days a week. So 5 times 30 minutes exercise every week is the minimum that you want to do. And depending on what age, your activity level, even simple things like going for a walk sometimes will be good.
Awesome, that's good advice. Yeah. So while we're on the topic of joints, so you do shoulder, the big joints, knee and hip. Is there any joint preservation strategies that people can participate in? Absolutely.
So I always like to look at things in an algorithmic approach. So there are non-surgical things and then there are surgical things. So let's talk about the non-surgical things first. So this is kind of just what we spoke about: exercise, maintaining good body weight, having a good diet, staying away from smoking, alcohol, drugs. Interesting anecdote that happened actually this morning. I had a younger individual. Every examination, every test that I did was normal, but they still kept having knee pain. And it ultimately turned out that this younger individual was addicted to weed. So they kept falling.
Oh, wow.
And it had nothing to do with the joints. But there was joint pain everywhere, which we were unable to figure out. Every test came back normal, but the patient just kept falling because they were addicted to weed, and hence they had poor joint health.
Wow.
So such a unique thing, but here they are in an orthopedic surgeon's office wondering about what's going on with my joints. So that's the non-surgical part. Like I said, healthy lifestyle is the key to it. Then we also perform a bunch of surgeries to preserve your joint, so we don't have to jump to a joint replacement operation. Now, if people get injured at a younger age, let's just say somebody gets into a car accident and they're in their 30s, we don't want to really offer them a joint replacement, which is more for the senior population or even people in their 50s. So we perform surgeries which may be keyhole surgeries, as we commonly call it, or arthroscopies. Now, arthroscopies have improved a lot and changed a lot. We're lucky at Bossier Orthopedics that we are probably only one of two groups in entire Arclitex that offers hip arthroscopy.
Okay.
So basically, if let's just say you have a tear in the hip joint, we can introduce equipments, and I have some if you want me to show them.
Yeah, I would love to.
So this is an example. I don't know if the camera can be focused on the tip of this or not, but it's very tiny, as you can see, compared to the tip of my finger right here.
Yeah.
So we can introduce these into the hip joint.
Okay.
So this is basically smaller than pen, and there is no open surgeries or no open large scars. The scars are barely a centimeter in size.
And so that's what you're calling the keyhole.
That's
right?
These are all part of the keyhole surgeries. And
gotcha.
so what we can even do is, if this is the hip joint, we can place these stitches or sutures or through a tiny keyhole, like I said, a centimeter in size, this much, and do this whole operation through it now.
And this is helping to preserve, maybe lessen the pain?
Yes.
Okay.
And in our practice, like I said, my partner, Dr. John Mays, myself, I think we're I just know of one another individual besides Dr. Mays and myself who do perform this procedure in a very large area. So we're very honored and happy to offer this service to our patients. So this is part of the hip preservation portfolio. When it comes to knees, when it comes to shoulders, there are various options of putting cartilage grafts in there. So like I was saying, if somebody gets injured, there is a small piece of cartilage which gets knocked off.
Yeah.
We don't have to go to a joint replacement. We can do a cartilage graft procedure.
Gotcha. Yeah. Okay. So so joint preservation is, you know, it's kind of this stepwise, I guess, piece of the puzzle, you know, like, so, you know, joint replacement, would you say maybe that is, I guess, maybe the very far spectrum, like, you know, this is maybe the end goal, or not goal, but like, let's say, you know,
the end option.
Yeah, end option. Okay.
Absolutely. Yeah. So let's just say somebody's in their 60s. They've tried other options, and these other options could be trying things like injections. We have a lot of patients we provide steroid injections for.
Yeah.
Or there are lubricant injections.
Okay.
Commonly people like to call them as chicken coom injections or rooster coom injections. So we can use these injections as well, along with medication, physical therapy as well, to help delay joint replacement surgery.
Yeah.
Once you come to a point where you've tried all these options and, you know, nothing is working, then we move on to doing joint replacement surgery.
Gotcha.
So it is what like I said, and you said, it's the end option for this.
Yeah. Okay. And so how long do you usually suggest or say that joint preservation will last before you may consider the replacement?
So that's very individual. we try to do that as long as we can, let's put it this way.
Yeah.
And once these have failed, and that number may be different for different people, the younger the patient, the longer we try not to replace the joint. And as we see the senior population where their mobility is really getting compromised, then we move on to the joint replacement.
Okay, yeah. What is would you say your average age for a joint replacement?
Anywhere from 60 to 65. That's when we looked at our numbers from last year, that was our average age.
Gotcha. And so, so with joint replacement, you know, like, what is maybe your most common one? The hip, knee, shoulder?
So the knee tends to be the most common one.
Okay, gotcha.
And the followed by, I would say, hips, and then shoulders.
Yeah. Okay. And knee, probably a lot of times, like you're on your knees a lot of times. You know, you may not be using, I guess, your hip as much, especially maybe if you're overweight and you have extra weight on your knee. Maybe normal wear and tear, would you say?
Yeah, but I think it's just a general rule that the hip is a nice ball and socket joint, so it tends to wear out less than the knee, which is more of a flatter joint.
Oh, okay.
Yeah. So knees are some of the most common operations we do. And, you know, like you and I were discussing, we offer a lot of advanced technology because you can do the same replacement in a very traditional way, prolonged recovery, but then there are other various methods that we employ which are more advanced and help in faster recovery, which are less invasive as well.
Okay, yeah, so I'm excited to talk about some of the new technology that your practice probably uses. We've talked about I don't remember how to say that word. Well, the other word, this one, what was this called?
Hip arthroscopy.
Okay, and that's a preservation tactic.
Correct.
That's also kind of a newer technology. But then the hip insight, it's very cool.
Absolutely.
Yeah.
So I actually have the hip insight if you want to look at it.
I would love to, yeah.
So if you've seen some of the Iron Man movies, I know I joke about that, right? Yeah. The screen that he wears gives him augmented reality. Augmented reality means that he is able to gather data, like let's just say we're driving. Now when I put this headset on myself, I don't want to knock off my mic, but I'll try. Like this.
There we go.
What the data that I'm seeing in the surgery is I see the patient's skeleton, I see numbers, I see angles.
Cool.
So what it does is it makes everybody's unique anatomy available to me. People are tall, people are short, people are narrow, wide. So this helps us take the guesswork out. And this, we're very proud to say that, again, this is only our practice at Bossier Orthopedics offers this technology.
Very cool.
And I think in the 5 southern states, there are only 4 or 5 practices in the whole area which offer this.
Nice. Yeah, so take me through this process. Like, are you have this on while you're performing the surgery?
Correct.
Okay.
So the patient gets a CT scan and the x-rays. That information gets uploaded onto this. So actually before I do your surgery, I've already done the virtual surgery planning before the real operation.
Okay.
That gets uploaded onto this. Then just like the GPS trackers in your car, we have these trackers which fit on your hip during the surgery. And then the nurse will come and put this on my head. And once they put it on, and I can actually talk to it and say hologram 1, hologram 2. So it's voice activated, and I can see different parts of the hip, and it shows me where exactly my bullseye target is, and it makes it very simple actually.
Yeah, yeah. So how has maybe surgery changed since you've included this in your practice? So
we're all human. We try our best, and you know, doctors are very driven, type A personalities. We don't aim for 99, we aim for 100. So where do you find that mysterious 1% is where these technologies come into play, is getting for that 100% result, trying to take the human element, the human error part of it away. So there's a bunch of artificial intelligence built into this, where the AI part will look at your unique anatomy, it will generate a plan, and then I can agree or disagree with the plan and make changes to it. But we use the AI along with the augmented reality to do this.
Yeah, so it's only maybe enhanced your practice.
Absolutely,
for sure.
absolutely.
Okay. Yeah. Oh, we've got a caller on the line. Tara, thanks for joining us. What's your question?
My question is, I'm a 62-year-old female, and I do a little bit of powerlifting. And my question is, if I skip like for a couple of weeks of going to the gym, then I get increased joint pain. For instance, if I am deadlifting, I only pull about like 135, and my wrists are great. If I skip deadlifting, I feel like I can barely even hold my book to read it with my wrist and my thumb in the opposable thing. And for squatting, I probably don't do more than 95, just below parallel. But if I skip squatting, I don't know, it's like it just hurts more if I skip. So is there some fluid or something that is keeping the joints lubricated if I continue and to have some regularity and some consistency?
So I congratulate you. You're extremely active, and that's fantastic. Please keep doing that. By what you're describing, again, I've not examined you or I have x-rays to go by, but by what you're telling me, it feels like you probably have some amount of arthritis, and you've been very successful in managing that by exercise. And when you stop exercising or take a break, it catches up with you. The fluid that you're describing, we call it synovial fluid, and that's one of the reasons why we were talking so much about exercise and its importance is you want to keep it moving. And when you take a break, the fluid stops that movement, that circulation, and as a result of this, the arthritis in the background, that starts acting up. So I mean, I would really need to look at some x-rays and do a physical exam to give you a definite answer, but this is what it's sounding like.
So would that be osteoarthritis?
Yes, ma'am, osteoarthritis.
Okay, well, I self-diagnosed myself.
Well, you did
good.
I
appreciate your answer. All right, well, thank you very much.
No problem. Have a good day.
Okay, bye-bye.
Well, thanks, Tara, for your question. If you have a question and you're just joining us, give us a call at 318-219-4569. I have Dr. Vic Chatrath with me from Bossier Orthopedics, and we're talking all about joint health and joint replacement. So give us a call if you have a question related to that. So she brought up a good point about arthritis.
Right.
Would you say that this is a pretty common, progression of maybe joint replacement?
Yes, that was actually, she brought up a really good point, and it highlights the importance of exercise, that what we were harping on is by keeping your joints strong, even if she has arthritis or osteoarthritis, she's actually delaying treatment or the need for treatment because she's so active, she's so healthy that she's managing her own pain through exercise.
Yeah.
Now, if this happens very consistently, then there may be a need for intervention. So that's where I was talking about steroid injections, lubricant injections. Those things can be looked into as well.
But it kind of is just a band-aid for maybe, what does it actually help you say, or would you say like the injections, or does it kind of just delay the need?
See, I wouldn't call it necessarily a band-aid at all times, because sometimes there are social events.
Oh, right, yeah.
We have patients where one spouse is unwell and the other one has to take care of them. I have multiple examples where one patient, the husband or the wife had cancer. So between the two, okay, I need to manage my husband's cancer treatment. What can I do? Okay, we'll help you with steroids and injections and medicine till you can get this resolved.
Yeah.
Once that's taken care of, we'll solve your problem.
Yeah, I think that's a good perspective, because I think maybe a lot of times maybe people don't realize that this is actually effective, especially if we're not able to have surgery right
Absolutely.
now. Yeah.
And we work with people. I mean, we're not out there to do surgery on everybody. We understand the social situation. We understand people have families, lives. weddings to attend, grandkids,
Yeah.
all those things.
Right, yeah. So take me through the recovery process. So let's say you've had the knee, hip, or shoulder replacement. I'm sure it's different maybe for different joints.
So hips are the fastest to recover, which we have even accelerated more by all these technologies. Now, in the past, hip replacements were done by the side or the back by cutting through the butt muscle. Okay. The way we do it now is through the front. We actually don't cut the muscle, we go between the muscle. Okay. So you can think of when we're not we're not cutting the muscle, the recovery time goes in half. That's called the anterior approach, where there's a tiny incision in the front, and the recovery time is amazingly shorter as compared to a more traditional approach with that.
Yeah.
Most patients walk right within an hour after surgery.
Wow. Awesome.
Granted, they'll be with a walker and they'll need some help, but we get them up right away. By 6 weeks, most people are doing really good with this.
That's awesome.
Yeah.
That's incredible. So how long do joint replacements usually last?
Well, that's a very good question. So typically 20 to 25 years is the expected lifespan of a joint replacement surgery. And what really wears out is between any joint there is metal and plastic sandwiched in the middle. The plastic liner is the one which wears out. That technology has improved by leaps and bounds in the last decade. So we're hoping that this plastic may even last longer. Now, we get 20 to 25 years, and that's why the goal is to do it in people 60 and over. So most of these people are able to enjoy the whole joint replacement through their lifespan. Now, we have to do redos. I just did a redo yesterday on an older individual where the plastic liner had wore out, which actually was barely a 20-25 minute surgery, because all we did was we kept the top part, we kept the bottom part, we just popped the plastic liner, put a new plastic liner in there.
Nice.
And hopefully that's going to be good for the rest of their life, and they won't need another operation on that knee.
Right, yeah. So let's say you've had the replacement and maybe it's time to have another replacement. What are those symptoms that people typically experience?
So people will start feeling that their knee replacement or hip replacement, which was functioning quite well, is now painful. They will feel that they can't trust it. It's unstable. Knees especially, they'll feel that there's swelling in the knee or it'll give out on them.
Yeah.
So those are some of the common symptoms that patients describe. Then we'll do x-rays, CT scans, bone scans sometimes to add to this as well.
Okay. Is there any candidate or any patient that maybe you would not recommend have this surgery? Like, let's say they have the symptoms, but just maybe they have underlying health conditions that you may not recommend for it.
Yes, we definitely first look at your blood sugar levels, or if you're diabetic, there is something called A1C. We want to make sure that your A1C is below 7.5, at the most below 8. Otherwise, the risk of getting an infection becomes astronomical. On top of it, a lot of patients in that age group have had cardiac issues, if they've had heart surgery. So this is a team approach. We work with the cardiologist, we'll work with the nephrologist if they have kidney issues. A lot of the African American patients have more kidney issues racially than others. So in that case, we want to make sure that their kidney function, so we work closely with the nephrology team to make sure that they are safe for surgery. You involve their family doctor as well. So like I was saying, this is a complete team approach before we decide, okay, you can actually go through with the operation or not.
Yeah, yeah. And it's a process too. It's not like you see you for the first time and it's like, all right, let's have surgery now.
No, it is a process. They even go meet with the anesthesia team. The anesthesia team does a really good job of going over everything to make sure that nothing's been missed and whether they're ready for surgery in a safe manner or not.
Yeah.
Safety is our number one concern there, that we want to make sure that at the end of this episode you're safe and we've done a good job for you.
Absolutely, yeah. So let's say, you know, someone is interested in having a joint replacement and they come and see you and have a consultation, maybe get some blood work and see if they're a good candidate. What are kind of the next steps? Is this something that's covered by insurance?
Yes, so that's covered by insurance, and every insurance company has certain requirements. So we are very good at record keeping, very diligent about our notes, and those records have to be submitted to insurance as well.
Yeah.
After that, we invite patients to come and attend something called Joint Camp. It's a 2-hour teaching camp which is done every second Thursday.
Cool.
So what this teaching camp does is you meet with the physician assistant who help us during surgery. They're very involved with the operation. You meet with anesthesia, you meet with pharmacy, you meet with a social worker, and this is a team approach where 2 hours of teaching is provided. So people who don't are like right now, sometimes there are patients who are not very sure that, okay, I'm ready for a joint replacement. So they will even go attend the joint camp and get the information from it. And then they can make an informed decision that, okay, I'm ready for this or I want to wait.
So is this a camp that they have to register for?
Yes, they can register the camp through our clinics.
Okay, cool.
Yeah, absolutely. They can contact our clinic and once they see us and they want to register for the joint camp, we make all arrangements for that.
Very cool.
Yeah.
And so I feel like we've talked about this before, but a satellite clinic, do you guys have these around?
Yes, so we have 2 satellite clinics. One is in Spring Hill.
Okay, cool.
And one is in Ruston.
Nice.
So both of these clinics were becoming quite important because we were seeing patients driving from Arkansas and northern Louisiana, and their driving distance was a lot, and sometimes when we needed more investigations done, it became a lot of back and forth. So it was difficult for the patients, so we decided to add a clinic in these 2 locations at least. And that's helped a lot for the patients, where they can get a bunch of stuff done locally, and then they can also come see us here in Bossier as well.
Nice. Okay, very cool. That's just something maybe newer that you guys are offering.
Yes, it started the 1st of this year, so we're 6 months into it now.
Yeah, and how long have you had the Hip Insight?
So Hip Insight, I started doing this in December.
Okay.
This is like Hip Insight meant for the hips, but for shoulders and knees as well, we offer very exciting technology. We've been doing robotics for a long time now, and all our knee replacements are done robotically as well.
Cool.
And that is amazing because the amount of accuracy with the robot is nail's breadth, 0.5 millimeter, 0.5 millimeter with that.
Yeah, nice. And so for your surgeries, how far in advance, like let's say I wanted to book my surgery today, when can I expect to have that done? So
typically our surgery schedule stays booked out for around 2 months.
Okay.
Okay. And because we always have to keep room for emergencies, things that show up unexpected, fractures or injuries, so we always have to keep some room for that. But typically 2 months is the time frame. And a lot of patients plan it this way, like if they have family who have time during Christmas, they can come and help them in Christmas, or summer vacation, they have a daughter who lives in Minnesota and she can come when the kids are out of school. So we always request them, just call me 2 months in advance.
Yeah.
So that you get a date of your choosing and not my choosing.
Right, yeah, and that's good to know, just you're planning it out, because it is an elective surgery.
Absolutely,
so it's
it is an elective surgery.
That you can plan out, you know, you don't plan for those emergencies.
I know, and that's why we have to keep some room, so, plus we need time to get all the testing, like I was talking about cardiology, nephrology, so that's why the 2 month time frames is the best that works out.
Cool, okay, we only have like 1 minute left, so tell me, where can we find you here in Bossier?
So I'm with Willis Knighton at the Bossier location, apart from the 2 satellite clinics. Our phone number is 318-212-7841. So I'll repeat the phone number, 318-212-7841. And Willis Knighton at Bossier is where our primary clinic is.
Nice. Well, it was very nice talking with you, Dr. Chatrath. Always a wealth of knowledge. This is really cool. You're just like our local Iron Man.
Thank you so much. I appreciate it.
Awesome. Well, that's all the time that we have for your Healthline today. Thanks for joining us. We hope you have a healthy and wonderful Tuesday.